Liposuction. Liposuction is one of the procedures in the United States that's very popular right now. The reason why is because it makes a profound change in the person's shape. A curve, the S curve in the waist, the hourglass figure is one of the things that makes the most pronounced change and improvement in a person's appearance. Liposuction is a fat surgery. What you're doing with liposuction is that you are attacking problem areas of fat, the areas in the body where you have a higher concentration of fat cells. These are the areas where you gain weight first and lose weight last. What you're doing with liposuction is you're decreasing the concentration of fat cells in that problem area and trying to get an even concentration of fat cells between the problem area and the normal area. The reason why liposuction works is because fat cells don't replicate. You're born with a certain number of fat cells and you keep the same number of fat cells throughout life. As you gain weight, each cell gets larger, and as you lose weight, each cell gets smaller. So that's why liposuction works. When you take a fat cell away from one place, you don't grow another fat cell in that place. Liposuction is not a weight-changing procedure. Most patients' weight will not change more than 4 or 5 pounds with a liposuction. It's a shape-changing procedure. And you have to remember, this is a rob Peter to pay Paul type of procedure. When you take one storage place away, another one will take over. The goal with liposuction is to get an equal storage area from head to toe. A perfect liposuction, you have an equal layer of fat, and you gain a pound, you gain it from head to toe. You gain it evenly. And that's the goal with liposuction. What you're physically doing with liposuction is using small cannulas that can vary between 2 millimeters and up to 5 millimeters, and coring out fat cells. When you core out those fat cells, you're creating, you're changing a solid into a sponge, or solid into a Swiss cheese. After the suction, you're going to wear a garment to help collapse that sponge and let that heal in that collapsed state. That's essentially, what you're trying to do with liposuction. Now, a person that is a good candidate for liposuction is a person that has good skin tone with few stretch marks and doesn't have a lot of redundant skin. You will get some skin contracture with liposuction depending on how it's done. The superficial liposuction can induce some skin contraction, so you can have some change. But skin that's damaged or weak without tone may not contract well. So that's one of the limitations of liposuction. The liposuction does make a profound change in the waist, and it gives an appearance of making the hips look better. If you make the waist narrower, the hips automatically look better. The recovery from the liposuction is a little bit rough for the first 48 hours. First day, you have the feelings of anesthesia, nausea, vomiting, throbby, achy type of pain. Second day, maybe the pain is decreased by 50%. By the third day, maybe the pain is decreased by 70–80%. Most of my patients, by day 4 or 5, they are finished with the narcotics and doing pretty well. The average time that people take off with the liposuction may be from 5 to 7 days off. The results from the liposuction will take up to about 3 months to see your best result as the swelling resolves. After the surgery, you're going to see an initial change. You'll see that the waist is smaller, the shape is better. And then over the next 2 to 3 months, the waist will get narrower as the swelling goes down, and the shape will improve. The final results will be seen anywhere from 2 to 3 months after the liposuction. On very large liposuctions, sometimes even longer. The complications associated with liposuction are the complications associated with surgery: blood clots, pulmonary embolism, bleeding, infection. Those are the complications you have to consider with liposuction. The liposuction is done with general anesthesia, and the complications of general anesthesia are also present. Most of the patients with liposuction have really a very pronounced change in their shape and the figure, and it's one of the procedures that makes the most change in a person's look.